So thank you so much for the opportunity to come and chat with you today. And I would like to also send the regrets of Dr. Carlston. I'm not Dr. Carlston. He is trapped. He's trapped on a small island on the East Coast, and there was a big storm, and he wasn't able to even get off that island, let alone fly back. So I'm taking on his slides and mine, and I'm really looking forward to talking to you a little bit today about a project and really just in general airway health on the Sunshine Coast. So I'm an associate professor at UBC, and I'm also involved with this group called Legacy for Airway Health. This Legacy for Airway Health was created from a very large donation that was given to Vancouver Coastal Health from a patient who passed away but didn't even know that he had lung disease until his last days. And met Dr. Mark Fitzgerald, who was a respirologist at Vancouver Coastal. Maybe some of you might have even have seen him if you've ever gone there for care. And this particular patient gave a donation of $25 million to Vancouver Coastal to basically try to improve airway health in people living in BC. And so from that, this particular program at Vancouver Coastal called Legacy for Airway Health was created. And that is run by Dr. Chris Carlston. And so the, I guess, image or vision of this particular Legacy of Airway Health is to try to create a framework for improved prevention, care, and quality of life for people with airway disease like COPD or asthma, or even at risk. And I would say that probably a lot of us are at risk of getting a particular airway disease with a lot of the changes that are happening in our air quality. But the problem is that there is really an inequitable resources available for prevention, diagnosis, and treatment for people that have or are at risk of having chronic lung disease. And, you know, we like to think that our healthcare system works okay, but the reality is that there's also a fair bit of inefficient use of resources as well. And so what we would like to see is improved access for people that are living on the Sunshine Coast and really any rural or urban area in Vancouver Coastal and BC, improved access to getting the resources that we need in order to be able to reduce risk factors, have more, an earlier diagnosis, and then subsequently better care and better health outcomes for people. So one of Legacy's first tasks is they wanted to get an understanding of, well, what is respiratory care looking like? And Ron, you kind of mentioned, you know, you've been the thorn in the side of Vancouver Coastal Health for a while, and that kind of thorn enabled this kind of work to happen. Where if you have a look here, we've got the different communities listed. That's my little, I don't know if my arrow, no, okay, the pointer has been found. So you can see here that we've got the urban and rural, you know, some of the urban and rural communities, and then the different kinds of resources that are important for people that are maybe at risk or worried that they have chronic lung disease or actually have it. And so you want to have resources related to diagnosis. You want to have resources related to treatment and maintenance throughout the whole time that someone might have COPD, chronic obstructive pulmonary disease, or asthma. And based on these colors, you know, we're doing okay in some areas. Acute care, there are mostly hospitals for us to go to should we end up with a problem with our lungs. But you can see that things like spirometry and, you know, other kinds of COPD management or asthma care, respiratory education, when this was done in 2021, you know, here you are. There's a lot of red on that line. There's a lot of services that were identified as lacking in 2021. Now, Rosemary and her colleagues are going to be talking more about what is actually available now. Things have changed since 2021, but nevertheless, there's still a fair number of gaps in care. And it's a problem because the rates of COPD and asthma are going up. There's been about a 50% increase in the numbers of people that have COPD or asthma in the last 18 years or so. And this causes a lot of stress on the healthcare system. When people go into the hospital with these conditions, they have a very high likelihood of being readmitted. And so that means quite expensive costs for the healthcare system and, of course, for patients and their families. And so there needs to be a different view. There needs to be a framework for COPD and asthma throughout the whole province, but really specifically in more remote and rural communities as well, based on the previous with all of that red showing. So a lot of these increases in COPD and asthma may be driven by the fact that, our population is aging, and these are often, especially COPD, they're often conditions of an older adult. But climate change has a role to play here as well. And so we know that basically it's getting warmer. We're getting the impacts of smoke in our area, and also the warmer weather and the wet often will create more of the kinds of plant that actually have a lot of allergens associated with it. And you might have noticed that from the difference from when you were young to now, that there's a real change in the amount of pollen that's in the air, and changes with just our overall air quality in terms of things like ozone. So when we have that background of worsening risk, and then we just have our own individual exposures and genetics that make us more likely to have lung disease, these two things together can really make it worse to either get the lung disease to begin with, or even if you have it, you might notice that things have really changed for you over the last few years. You might be, if you have asthma or COPD, you might be aware that the climate is really starting to impact how you're feeling. And of course, the comment, Joanna, that you made about the air quality, this is what we're all living with, right? It seemed like in Vancouver and the Lower Mainland, it wasn't that common that we were really exposed to that much smoke in the Sunshine Coast, Vancouver Island. But now it's a pretty regular thing, and we're all starting to be impacted by these consistent smoky days throughout, really the whole summer period. And the smoke is important because of the particles that are in it. See, these two pictures were actually just taken 5 days apart. I'm not quite sure why the order's there, but the later picture is the nicer day. But just 5 days prior to that, it was quite a smoky day. And that shift can happen, just as we know, when the wind changes. You can go from a pretty nice day from air quality to really a rapid decrease in air quality. And it's those PM 2.5. That's kind of the magic thing that you're going to start hearing more and more about. It means particulate matter that's super small, 2.5 microns in size. And these are the little tiny itsy bitsy particles that when we breathe in, they get deep. They go deep, 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 deep into the lungs and cause all sorts of damage. So when you see those air quality measures that Weather Network puts out, and they say it's a 3 or a 5 or an 8 or a 10 plus, that is mostly based on that particulate matter. And when it starts to go up, that's when they start to put out those air quality measures. And so that's something that we're really starting to deal with now. And sadly, this wildfire smoke is starting to erase all of the progress that we made on clean air over the last several decades with all of what was the name of the thing for the car that you had to do? You had to go get your chart, air care or whatever, yeah, and you had to go and do that. We spent a fair bit of time thinking about emissions from our cars, trying to reduce different kinds of emissions from manufacturers, and unfortunately, a lot of that work is kind of being erased by having these regular exposures to wildfire smoke. So, we all kind of experience that, but the reality is that if you have asthma, COPD, you might even notice it more. It might not take much for you to really feel, even if the air quality is just a little bit worse, you might already be kind of aware of that kind of heaviness of the breathing. And that really shows up in things like the hospitalizations. And so on this graph, the black line, right along there, that is that particulate matter level. And the blue bars are hospitalizations, or visits, I should say, visits to the doctor, not even hospitalizations, but just visits to the doctor for asthma, and they go hand in hand. So that's not a big surprise, but sometimes we need to kind of do this kind of research to kind of convince everybody that, yeah, this has a direct impact. And I don't know, Ron, if you see this, but on an air quality day, it might take a day or two, and then all of a sudden the phone starts ringing. People are feeling like they can't sleep that well at night. Maybe they're using their inhaler a bit more. They might get an exacerbation of their asthma or their COPD. So the research side of this is important, and there's been a lot of great work that researchers like myself, I would say, and Chris Carlston has been doing. And an example of that is this study that was recently done by Chris and his team, just even looking at, should we be providing HEPA filters to everybody? Would it be cost effective for the government to give us all, let's all have one, or two, or three. Maybe if we all had one of those in our house, we would reduce those visits to family physicians, reduce those hospitalizations. Wouldn't having to actually look at that cost benefit. It's a hard one for governments to get their head around because, sometimes the money that pays for one thing, and then you have to see the savings in another. But things like this are what researchers are looking at, the policies around what happens what if I provided everybody in this room with an air quality, a HEPA filter, the filtering system, and we saved one visit or two visits to the hospital. I bet you that would pay for this room 5 times over. They're not that expensive compared to a hospital visit. So those are the kinds of questions that researchers are. But it's not just about what the researchers are finding interesting and what they're curious about, but also what are patients saying about their journey with respect to having a chronic lung problem. And so some of the work that Legacy did was actually running kind of like focus groups about, tell us what it's like to have a breathing problem and living in the Vancouver Coastal Health area. And so this graphic was created. Now, you can't see all the little words, but basically these are kind of fun things to do to be able to show in a different kind of way, not just with charts and numbers and things like that, but kind of show more like a story. What is it like when you think that you might have a breathing problem and then you're actually going through the diagnosis? And these kind of stories, like a journey of COPD or asthma, are created. And so some of the things that are highlighted here are that it takes me forever to get the diagnosis. I can't even get access to the tests that we need to get the diagnosis. That's a breathing test called spirometry. So people are frustrated because it might take them a while to go to the doctor, but then when they go, and the best test to actually understand how your lungs are working is the spirometry test, it might not be available in the community. So that can be frustrating. Another thing that people, of course, just like what I presented, they're concerned about the impact of something like a wildfire on their breathing, but then they're also told, well, you should get out, you should be more active, and then people are like, well, what do I do? Like, should I stay indoors? But that doesn't seem very healthy. But then if I go out, it makes my lungs feel like breathing too hard. So those are some of the things that people shared about their journey with having a chronic breathing problem. And then also just, understanding about, well, I've been a smoker all my life, or I've been exposed to different kinds of inhalants. How can I get some treatment to help me stop that, or reduce the risk maybe of my family member who continues to smoke? And there isn't a ton available for people that want to quit smoking, unfortunately, in BC. There's a few government programs, but not nearly enough of what we need. So those are some of the things that patients have been telling us. We've got the list of the services that might be lacking, and we have the stories that patients are telling us about what they're noticing, where the gaps are. And so we think, well, why can't we just change it? What's standing in the way? And certainly there's a lot of research that has been done to look at improving our healthcare system. But then they enter this thing, the valley of death. Sounds gloomy. I mean, it's obviously is gloomy. But, I think sometimes, we wish that research would just go from the lab to Dr. Monday's desk like that. But the reality is that most research doesn't even change clinical practice. So we might have things that are happening, at the bench, and it's all very exciting in the test tubes, and everybody's creating maybe new medications or new ideas, and they might be tested and validated in a group of patients. Those are the sort of trials that are done to try to see, hey, is this particular innovation or this particular medication going to work? But it takes a long time for that to happen. It kind of goes through this valley where it doesn't really go from the bench to testing in patients for a very long time. But say, hey, it goes through the trial, gets approved by Health Canada, it's potentially a great intervention, then it hits the next valley of death. It doesn't actually make it to any kind of guideline that a physician might see, or there isn't the resources to be able to actually provide that particular intervention, like a medication or a rehab program. There's lots of, and even if it does, it might not have the support to fund it forever. So there's all of these, what we call knowledge translation valleys of death, where ideas kind of don't make it to actually improving the health care, the health of people that need it. So something like, if I was to do a study, it would probably take 15 or 20 years before it would actually make it to changing clinical practice. And there are tons of barriers in the way. It's not the fault of any one particular player in that. It's just the way healthcare is. We create a lot of research that never gets used, and then a lot of research that needs to be done doesn't get done. So there's lots of these gaps. And so Legacy is trying to kind of work with the healthcare authorities that have a role, care providers like the physios and the physicians and the respiratory therapists, and communities to try to do something. And I'm going to tell you about one of these somethings that we're hoping to try to do to improve the respiratory care services here. So Legacy for Airway Health is trying to work in this space to reduce these valleys of death, as they're called, where good ideas go to die. So how does it work? Well, it's a bit of a small graph, but basically knowledge is out there. We might create it through a particular study, but in order for it to work in a local place like Gibson's, like Sechelt, we need to be able to find what kind of knowledge is actually going to be relevant for this context. So say we wanted to start a pulmonary rehab program, and I've got a pulmonary rehab program in St. Paul's that I've been running for a long time, but it might not actually work the same here. We might have to kind of think about the evidence that we know about something like that and actually adapt it to the context here. So adapting, talking to local people and adapting any kind of knowledge to what needs to happen here is a really important part. Understanding the barriers. I can come up with all my ideas in the world. Hey, Vancouver, we do this, or I've lived up north, we do that. But until I talk to the people that actually live and work here, I'm not going to maybe have anything that's very successful. So we have to be able to take knowledge that the research land, creates and actually adapt it and create care and different kinds of services that work here in this context, and properly evaluate it and keep going. And so this cycle where research is part of the care that you get, and the care that you get really feeds into the research, having these things work more closely together instead of having them be separate. So this is what Legacy is trying to do in general. They want to build this culture of collaboration and partnership between where they are in Vancouver Coastal Health, where someone like myself is, more in the University of British Columbia, and then local communities, like those on the Sunshine Coast, to build this network where we can start to think about different things that can happen together. So how has that then changed in terms of going forward? Well, this group came together, and Ron and Rosemary said, I came to visit a year ago and said, hey, there's this big grant. Do you want to be a part of it? We're going to call it Spiro. And it's about spirometry, but really is about so much more. It's not just the tests that people get for their lung problems, but it's like what happens to get you to the test and the care that somebody might get if they end up with a chronic lung problem. So we called it Spirometry for Improved Indigenous and Rural Respiratory Outcomes. And so it's really about building that culture of collaboration and partnership and focusing on the Sunshine Coast and looking at some of these red boxes. How can we switch this around? How can we partner together to try to attack some of these gaps in care and see what we can improve? So you can't get good care unless you are diagnosed properly. And so being able to have access to the tests that you need is the key part of it. And that's really kind of the starting point for our particular team. We've brought together researchers and clinicians and the healthcare authority and the ministry and other partners to try to come together and figure out how can we improve respiratory care services and how can we start with spirometry? And it seems like, well, okay, the spirometry test, it's this breathing test that you do. Why don't you just open a new clinic? But it's more than that. We have to be able to provide support for you as a community, for an individual person who might be the patient, and for the whole healthcare system to be able to really think about respiratory care in a big way. So people were saying, what if I had been tested earlier? You know, if I think I got kind of a dry mouth, I wonder if I might have diabetes. I immediately know, I'm going to go get my blood sugar checked. Everybody knows that. If I kind of have some chest pain, I'm going to go to my doctor and go, oh, I think I have some chest pain. He said, okay, let's go do an ECG. But if you had problems with your breathing, do you know the test? I've said it a million times, but would you have known that prior to coming in here tonight, that you need to have a breathing test done? And we need that kind of awareness. We need people to be able to learn more about their lung health and be able to pick up the signs. So in this audience, as you read this, you might think, oh, chronic cough, wheeze, and phlegm. I know somebody who always seems to be coughing even when they say that they're healthy. Or if you know someone that, every time they get a respiratory infection, always goes to their chest. Like every cold in their nose just goes to their chest. Or, they go up a slight hill and they're, those are really common symptoms. Or you can't keep up with people of your own age because of your breathing. So if you just knew in your heart that, like that chest pain, but instead I've got some problems with my breathing, that's going to trigger me to go and talk to my physician. And you need to know, well, I wonder what may be causing some of that. I was a smoker, or I worked in a job that had a lot of, gases and fumes. Or as a kid, my mom always told me that I had a ton of problems growing up, with respiratory problems. Or I've got a lot of exposure to things like wood smoke or secondhand smoke. If you know that you have those exposures and you're having symptoms, we want more community like, oh, hang on, I need to go to talk to my physician. And so what might be happening there? Well, you might actually have a little bit of damage in your lungs. Your airways may be getting thicker, maybe a little bit stiffer, like your air sacs at the very end of your airways can get scarred. And when those things get damaged, the air does not move in and out of your lungs into your bloodstream very well. So again, as we get more knowledge about what's happening with our lungs, we're able to actually go to our doctor and say, I want spirometry, and be able to just say that, right? And instead of wondering what's wrong, say, I've got this, I've got these exposures, I've got these symptoms, I would like to have a spirometry test. And so it takes about 30 minutes. You take in a deep breath. Has anybody done a spirometry test before? So quite a few. It's hard work, right? It's like, it's just plain hard work, but it's super effective to identify lung problems or to tell you that you need a further test. So it might not diagnose exactly what you have, but it often can indicate that there is a problem, and then the doctor can refer you to even more testing. So it's a key part of the care of people that are at risk or have chronic lung disease. And for us, it was a real starting point for this particular project. So we want to be able to, recognize that people are sent for multiple assessments. They also have ongoing care. So it doesn't just end with this part. I want to make sure I get a good diagnosis. But we want this whole journey to be a bit smoother for people that have chronic lung disease. And so for that to happen, We need to encourage physicians and nurse practitioners to order the test, because it hasn't been around for a while. If it's not that available, it kind of gets out of practice. We want, once your physician writes that order, we want you to be able to access it in a reasonable amount of time. And then once you get it, that you get the right diagnosis and the right care, whether it's medication or education or rehab, and for your physician to feel supported in their care of you, and for you to have a good understanding about what's happening. And so these things might be happening for you very well, or there might still be gaps. And so it's these gaps that we need to understand and address so that we can bring research and quality improvement side by side, where the hospital and the healthcare system decide they want to have better care, and we right away bring the research in to find out what's needed, what happens if we do this, what are the problems, what are the barriers. The research side of things can help with that. So we've got health authority leaders, part of this team called Spiro. I'm leading it. I'm the lead researcher, but we have a lot of different researchers. Some of them are physicians, some of them are respiratory therapists, some of them are physios, some of them are health economists. We have the government agencies, we have the clinicians, that are actually in your community, part of the team, and we have leaders in the hospital that are actually putting money behind it, which is always lovely. But we also would like to have members of the public in some fashion guiding what this could look like. And so if it's something that's interesting to you and you'd like to maybe be a part of what this is moving forward, then we certainly would like to hear from you. So that's a very quick journey into a little bit about some of the work that's been happening here, both in terms of understanding what care is available. Back in 2021, you're going to hear more about what's happening current, some of the concerns that people might have with their lungs, and how we need to kind of fashion a different way in partnership of being able to address some of the gaps of care. So thank you very much for your attention.